I actually want you to skip over to the slide that has the uterine tubes as the name across the top. This gives you a little bit better vision of what the whole structure looks like. So you can see the uterus, you can see the uterine tubes or the fallopian tubes on each side, you can see the ovaries. Again, the fimbriae look like they're attached even though they're not. But the biggest thing from this is, again, you get a pretty good idea where they cross-section out that uterus, just how thick the uterus is. But the other thing is seeing that you have that right and that left ovary, which you didn't get in the other pictures. Now, the thing that I want to point out about this is that, number one, because you have the two different ovaries, ovaries release your estrogen, and the estrogen is going to, in part, determine your symptoms that come along with your monthly cycle. So women will experience different levels of intensity of their monthly cycle just depending on what ovary is releasing the egg. So some months it might be pretty mild, don't really notice anything, and the following month it's very intense or severe, and you might notice that pattern of just having different symptoms from one month to the next, and that is all going to be dependent on which ovary is releasing the egg. The other thing that I wanted you to see from this particular picture is those three layers. So I talked about you have the inner and the outer layer, and you have the muscle layer. This actually puts the name to those. So you have the endometrium, which is the inner layer of the uterus. This could actually be where the blood lining is and where baby would implant. Then you have the myometrium, which is the muscle layer. Remember that prefix of myo is always going to indicate muscle. And then you have the perimetrium, which is going to be that outer layer. Now, one thing that I also wanted to talk about is when the egg ovulates and is released into the fallopian tube or the oviduct, that is actually where fertilization is going to take place. Fertilization does not happen within the uterus. So sperm is going to be introduced to the body, the female body. It would make its way up through the uterus, and then as it travels through the uterus, some of them are going to go into the left oviduct, some of them will go into the right. So immediately half of the sperm went the wrong way because the ovaries are taking turns. So 1 month, one oviduct is not going to have an egg present. It would be in the other one. So the sperm continue to track up through the female body into the oviduct or the fallopian tubes until they locate the egg. They will actually penetrate the egg, fertilize it, and then it's going to be another few days. It can be anywhere from 2 to 7 days that that egg will travel down into the uterus before it actually implants and is dependent on mom. Once implantation happens, now baby is drawing from mom's blood supply, so anything mom is putting in her system, baby is going to have access to as well. So this is an important feature of fertilization, that it happens in the fallopian tubes or the oviduct, and then has to take several days to get down to the uterus and actually implant, because sometimes mom is not trying to get pregnant and is not expecting to be pregnant. So if she's not expecting to and she becomes pregnant, by having several days pass before a baby is actually dependent on mom, it reduces the window of when implantation happens and baby is dependent, and when mom actually figures out that she is indeed pregnant and needs to maybe make some lifestyle changes for the duration of that pregnancy. The last slide that you have here takes a look at the hormone changes throughout the month. And at the top, you have LH and FSH. LH is luteinizing hormone. FSH is follicle stimulating hormone. So those two hormones, luteinizing hormone and follicle stimulating hormone, those two are going to really play a part in developing that follicle and getting it ready for ovulation. That's the priority of those two. So you'll notice that they're pretty low at the beginning of the month. They both spike in the middle of the month, and then they drop off at the end, because they're really focused and geared towards ovulation, which happens in the middle of the cycle. And so that's where they really come into play. On the other side of that, estrogen and progesterone are the two other hormones that are going to be utilized during the month. Estrogen and progesterone, you'll notice that they somewhat follow the same path. So they start out low at the beginning of the month. They both are going to increase into the middle, and then they drop off at the end. Now, the one difference that you do have is estrogen starts low, and then it's going to spike up, has a little bit of a decline, spikes up again, and then declines at the end of the month. Now, the one thing to kind of keep in mind as you're looking at this chart is that estrogen is also linked to serotonin. Now, serotonin is the hormone that is going to put you in a good mood. So you can see how mood could potentially change during the month and have an actual physiological explanation as to why. So when estrogen levels are low at the beginning of the month, that mood is going to potentially be in the same place. When you see that estrogen spike, that is going to pull up your mood. A little bit of a divot right about the middle of the month, so you might notice again a change. You get a little bit of an uptick, and then it drops off again. So some people don't notice a change in their mood whatsoever, but like I said, it is linked to the amount of serotonin that is released into your body. And so, with serotonin being a mood lifter, there is the potential to see that sway in your mood throughout the month. Now, if fertilization occurs, there is going to be a hormone that is given off by the egg, which is going to keep those progesterone and estrogen levels high, and that is going to maintain the lining of the uterus so that the pregnancy is maintained. But if that egg does not become fertilized and it does not emit a hormone, then what happens is those progesterone and estrogen levels drop at the end of the month. And with the drop in those two hormone levels, that is actually going to cause the lining of the uterus to degrade and be sloughed off, and that will trigger the bleeding that a woman would experience at the end of the cycle. All right, so check Blackboard for your assignments. Those of you that miss class, there will be some extra assignments that you can work on to gain some of those points back. So please make sure that you guys are looking at those. They are not extra credit. So if you were in class and did your assignments, when we met in class, you are good. These are just for those people that were gone and missed and need to earn some of those points back. So please make sure you are checking Blackboard this week and next week for those additional assignments, so that we can recover some of those points.